Hello, I'm Hugh Silk, a family physician and professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School, and I'm here to talk to you over the next 5 minutes on creating a model oral health curriculum for primary care schools and programs. This was prepared also with Judy SAVAGEAU and Kate Sullivan from my department. Our work is part of a cooperative agreement with HRSA, and it is a collaborative agreement between Harvard School of Dental Medicine, Harvard Medical School, and UMass Medical School, and some other partners where we created the Center for Integration of Primary Care and Oral Health. Let's jump right into lessons learned from the surveys and interviews we've done over the past 3 years, where we surveyed 13 different disciplines and hundreds of programs and schools, from midwifery to physician assistant programs, family medicine residencies to medical schools. And these are the lessons that we learned from those surveys and interviews. First, you need a champion. You need someone with some passion, not a whole lot of funding, but maybe paying for a little slice of their time, a lot of energy, and they'll gain the expertise over time or bring in experts. You need to convince leadership of the importance of oral health, and so showing them the relationship between oral health and systemic health, or showing them local statistics and, more importantly, the stories of patients that are being affected by poor oral health. You want to use local resources, whether they're resources like a dentist or a dental hygienist from the community who come to teach, or someone from an academic institution. And then thinking about regional, your oral health coalitions in each state, or the Department of Public Health, or area health and education centers. And then nationally, curriculum like Smiles for Life, which has downloadable modules across the lifespan, or the American Academy of Pediatrics with its PAC curriculum, or their Tiny Teeth initiative. It doesn't take long to achieve success because many programs don't have a whole lot of oral health, so just adding some can be helpful. And some of the missing components are oral health objectives, and because a lot of specialties and primary care specialties in particular don't have national objectives. So we've created some entrustable professional activity, EPAs, and you can find that on our website. Also, evaluation seems to be lacking, and so you could go to Smiles for Life to borrow some of their questions, or we can point you in the direction of schools and programs that have different types of evaluation. This slide is looking at sort of an approach to an ideal oral health curriculum, and some will start with just a one-day experience where learners go and work with a dentist, and over time maybe making that a whole week, where you might work with an adult dentist one day and a pediatric dentist another day, perhaps a dental hygienist on a care mobile or in a school, and an oral surgeon on another day. At the Virginia Tech Medical School, they have an oral health week where they cover a lot of different topics. A lot of programs will just have an oral health day where they'll have some discussions, some cases, some lectures, some guest speakers. At UMass, this diagram shows that we've created a spiral curriculum, and so in all of our courses across the 4-year span, you can see the little teeth which show that we teach a little bit in anatomy, a little bit in endocrinology and cardiology, and so the students keep coming back to that. By the time they get to their clinical years, they're doing even more things. This is a great opportunity for interprofessional education, and it's another thing that you can do is engage students and residents and learners to work on this with you so that you can develop your curriculum even quicker and with a student perspective. Lastly, I just want to say something about evaluation in general. We've created a tool where you can evaluate the curriculum as a whole. So that's what's on the left here, and you go through a series of 20 questions and then you get a score. We have evaluated this across the country and found it has about an 87% accuracy, so it really gives you a good score. And then as you evolve your curriculum, you can go back and score it again. So this is a really quick presentation, but if you want to download our evaluation tool, you can go to this website or use this QR code. If you want to visit our website at SIPCO, you can go to this address, and this is my email if you want to contact me, and I'm certainly happy to talk to you more about how do you engage leadership, how do you get some curriculum going in a program, and then build success over time. All right, thank you very much for your time today.